Ever been curious about how the NHS, the heart of British healthcare, actually came to be?
It's a story full, well, surprises, much like those cues everyone loves to talk about.
Oh, definitely. Just picture this. It's 1948, the nation's still recovering from the war, and suddenly, bam, free healthcare for everyone. Radical, right?
Revolutionary is more like it. Aneurin Bevan, he was the Minister of Health then, really spearheaded this whole thing, believed healthcare was a right, not a privilege. But getting there, well, wasn't exactly a walk in the park.
Right, so we've got the vision, but what about the actual foundation? How'd they even begin to build this thing?
Funny enough, it was the war itself that laid the groundwork, in a way. Before, you had this jumble of hospitals, some local, some charity-run, no real system. Then the Blitz happened. Suddenly, everyone had to work together under the Emergency Medical Service, I think it was called.
So the Luftwaffe unintentionally paved the way for nationalized healthcare.
Yeah,
Talk about irony.
it's true. But of course, wartime collaboration is one thing, peacetime policy, that's a whole other beast.
So what was the political climate like back then? Were people actually on board with this whole NHS idea?
Well, it all started with the Beveridge Report in 42. Landmark document, really. It argued for this comprehensive health and rehab service for all. And get this, both the conservatives and labor were surprisingly open to it.
Wow, both sides agreeing on something major that's a rarity.
Right. But of course, the devil's always in the details, isn't it? They couldn't agree on how much control the government should actually have.
Ah, the age-old debate. So what were the sticking points?
Well, you had Somerville Hastings, a big socialist voice at the time. He'd been pushing for state-run health care since way back in the 30s, and labor was listening. But the conservatives, while they liked the national healthcare idea in theory, they preferred things to be run locally, thought a big centralized system would be a bureaucratic nightmare.
Classic clash of ideologies, centralized versus local. Where did Bevan stand on all of this?
Bevin, oh, he was all in on central funding, national ownership, the whole shebang. Thought anything less wouldn't guarantee equal access for everyone. He really took on anyone who favored local control. Huge battles there.
Sounds like things could have gone either way. So how did Bevan actually manage to pull it off?
Honestly, it surprised a lot of people. The NHS we know today, that centralized structure, it's really a testament to Bevan's vision, his sheer will to make it happen.
What a legacy. But getting something off the ground and keeping it running are two different things, especially something as massive as the NHS. Did this honeymoon phase last?
Not quite. Just 3 years in, Bevan actually resigned. The reason? Charges for dentures and glasses.
No way, you're kidding.
Nope. He saw it as this betrayal of what free healthcare meant, caused a huge uproar. Even Harold Wilson, future prime minister, he resigned too, stood with Bevan.
Wow. Talk about putting your money where your mouth is, or rather, refusing to. That's some serious conviction. So, dentures aside, what were those early days of the NHS really like for the everyday Brit?
Huge change, obviously. Hospitals, doctors, all absorbed into this massive new system. Sure, there were bumps, but for a nation still healing from the war, the NHS was like this beacon of hope, a sign of a brighter future.
A beacon of hope, I like that.
Yeah.
But keeping that beacon lit, that takes serious fuel. And by fuel, I mean money.
Yeah, fueling that beacon of hope. That's the tricky part, because let's be honest, the NHS, it's not just a big undertaking, it's massive.
Massive is putting it mildly. We're talking about the largest employer in all of Europe, a true economic powerhouse.
Wow, that puts it into perspective. But big size, big responsibility, and I imagine even bigger bills to pay. So how does a system that gigantic even begin to fund itself? Well, back in 2015-16, they were working with a budget of, get this, 136.7 billion, and it took 1.6 million people to keep everything running. Most of that funding comes from, well, a mix of things. You've got general taxes, and then there are national insurance contributions.
So everyone chips in, ensuring that care is accessible when needed, no scary upfront costs. Sounds ideal in theory, but I imagine it's a constant battle to keep a ship that massive afloat.
More like navigating a hurricane of financial challenges. Healthcare costs, well, they tend to rise faster than the overall economy. Think new treatments, an aging population, it all adds up.
And those infamous queues probably factor into this too, right? Longer waits mean more complex cases down the line, which means higher costs overall.
Exactly. It's a vicious cycle. And all this pressure on NHS finances makes it, well, a tempting target for budget cuts and demands for greater efficiency.
And that's where we hear about those austerity measures coming into play. What do those actually look like in a healthcare setting? Paint us a picture.
Imagine a hospital that needs a crucial piece of equipment but has to postpone buying it because the funds just aren't there. or a ward that's understaffed because they're short on nurses. These are the real-world consequences of austerity, and they directly impact patient care. It's unavoidable.
It's easy to get lost in the numbers, but those numbers represent real people, both patients and staff. Sounds like a recipe for burnout on the front lines.
Burnout is a very real concern, absolutely. And it's impossible to talk about the NHS without talking about the people who keep it going, the heart and soul of the whole operation.
Couldn't agree more. We've got to look at the human side of this complex system. Let's head into what we're calling the staffing labyrinth. So we're stepping into the staffing labyrinth. It sounds like something out of a fantasy novel, but the stakes here are all too real.
Unfortunately, it's a labyrinth with very real challenges. The NHS faces a significant staffing crisis. Fewer doctors, nurses, GPs, you name it, they need more of them.
We hear about this all the time, especially when it comes to GPs. What's at the heart of this shortage?
It's a perfect storm, really. An aging workforce nearing retirement, coupled with not enough new recruits. Then factor in the impact of Brexit.
Right, Brexit. Didn't that lead to many EU healthcare workers leaving the UK?
Absolutely. The NHS has always relied on international talent, especially from the EU. But Brexit created uncertainty, and with a less welcoming immigration environment, many skilled professionals left.
Fewer staff, more patients. Those who are still working must be under incredible pressure. What does this actually look like on the ground for both staff and patients?
For GPs, it can mean an overwhelming workload. Some manage upwards of 2,500 patients.
2,500. That's practically a small town. No wonder there are concerns about burnout.
Exactly. Many opt for part-time or leave the profession entirely. For patients, it often means those long wait times for appointments and procedures.
There's that link again. Staffing shortages directly impact those queues. It's not just about efficiency, it's about sheer capacity.
Precisely. A complex equation with no easy answers. But amidst the statistics and wait times, we must remember the dedicated individuals working tirelessly to keep the NHS afloat.
Which makes understanding the impact of external factors, like Brexit, even more crucial. But it's not the only challenge the NHS faces. What about the impact of issues like social care and the rising costs associated with it?
You're right, it's not just about treating illnesses in isolation. The NHS is deeply intertwined with broader social issues. Remember that statistic about 1 in 10 UK hospital beds being occupied by someone with alcohol dependency?
It's a stark reminder that the NHS is also on the front lines of social challenges.
And these challenges put a strain on resources. The rising costs of social care, the growing mental health crisis, they all place additional burdens on an already stretched system.
It does feel like a constant game of catch-up. But amidst these challenges, how does the public actually view the NHS? It's often portrayed as a point of national pride, but is that the whole story?
Public perception of the NHS is complex. It's true, the NHS consistently ranks highly as a source of national pride. It embodies that British ideal of looking after one another regardless of social standing.
That's a powerful sentiment, but doesn't it also create pressure to maintain this idealized image even when the reality is far more complicated?
It does, and that's where the paradox comes in. While the NHS inspires pride, satisfaction with the service has declined in recent years. People feel the strain of long waits, staff shortages, and a sense that the system is stretched thin.
So pride and frustration seem to go hand in hand. Where do we go from here? How do we reconcile these conflicting perspectives?
That's the million-pound question. The NHS is at a crossroads. It's praised for protecting people from the financial burden of illness, but criticized for lagging behind other developed nations in some health outcomes. The newly elected Labour government has a 10-year plan to address these issues.
A 10-year plan sounds promising, but also like a long time when the issues feel so immediate.
It raises the crucial question, will it be enough? What fundamental changes are needed, and what sacrifices might be necessary to ensure the NHS can thrive for another 70 years?
These are questions for all of us to consider. As we've explored, the NHS is more than just a healthcare system. It's a reflection of societal values, priorities, and challenges. What role do we want it to play in the future? What are we, as individuals and as a society, willing to invest to safeguard its future?